So you're big on the laser to get rid of gum disease. Tell me a little bit about it. I guess there's two ways to treat gum disease. One is cutting and sewing, as you say, and one is the laser.
Yeah. Yes,
Tell
I've
me
been treating gum infection with the laser now for over 10 years.
Okay.
The traditional way prior to lasers was the old cut and sew. You literally had to cut and reflect the gums back and scrape on the teeth and then suture the teeth and the gums back together and let everything heal.
So
and
that's happening right now in Waco
still
every day?
still happening today. I mean, that's
So they open up the gums and clean the teeth?
Clean the root surfaces of the teeth, scrape on the bone around the roots of the teeth. Very painful.
Okay.
Much more post-operative pain, and it doesn't heal as fast as when we do it with the laser. No cutting, no suturing or sewing. We treat and kill the bacteria with the laser. We clean the root surface also with a different type of laser or with an ultrasonic cleaning device or scaler, whatever. Okay, and then you don't have to have any of this. You used to have a parodontal pack or a gum pack. It's like, imagine if you chew chewing gum.
Yeah.
And you stick it on your teeth and smash it up into the grooves of your teeth and then leave it in there for 7 days. How would you feel?
Not so good.
Wouldn't feel good. So that's the beauty of lasers. Now, and then of course lasers are now advancing into all other areas of dentistry. We're actually treating like teeth that need root canal therapy, where we're saving a tooth because it's got an infection and an abscess. We can use lasers to help decontaminate and treat the inside of the root system of the tooth, so we get better results with root canal therapy.
Is that right?
That's right.
So with these lasers, okay, so people lose their teeth, the number one way is with gum disease, which is a bacterial infection.
Yes.
So you safely go around the mouth, clean,
Kill the bacteria,
and then their teeth get stronger?
and then their teeth actually tighten up.
Why?
And get
How
stronger.
does that happen? How do
Well,
they get-
two reasons. Number one, the lasers actually now, we're proven that we can regenerate bone.
And the bone holds the teeth in
And the
place.
bone is what holds the teeth in place.
Okay.
Okay. So if we regenerate bone and we get the gum tissue to reattach and tighten up around the tooth, a tooth that had, say, a lot of mobility, it was getting really loose, about to be lost, we can get that tooth to tighten up. And
Because
we
this
save-
bacterial infections, the
infection,
gum don't like it and moves
the
away?
infection and the inflammation that comes along with infection, okay, is gone.
Okay, now you've been doing this a long time, like hundreds and hundreds and hundreds of patients.
Lots of patients.
Like thousands of patients,
Lots
possibly
of
with
patients.
the laser.
Lots of patients.
If it's a bacterial infection, when you get rid of this bacterial infection, do people report to you that they feel better? Like when you have the flu, an infection, when you get rid of it, you feel better, more
Sure.
energy.
Yeah, absolutely. And I want to tie into that here's again what we know, that infection and inflammation in the mouth affects the rest of your body. So it can affect your heart. You're at a higher risk to have strokes or heart problems or issues in the bloodstream, atherosclerosis and other types of things that can cause you to have higher blood pressure. I mean, we now know that this is a direct impact.
Yeah.
The health of the mouth, the infection and the inflammation in the mouth is affecting the rest of your body.
You know, in the book, The End of Alzheimer's, this Dr. Bredesen believes you could stop Alzheimer's. And in his book, one of the first things is you got to get rid of a bacterial infection in your mouth.
Right.
Because this goes into the brain and feeds these amyloid plaques.
Yes. And there was also even some research about the old filling materials that we used in dentistry, especially the old silver mercury amalgam filling materials, as potentially having a negative effect in increasing the risk of Alzheimer's disease.
So you don't use that at all?
No,
anymore.
I haven't used that since 1985.
So if you have bleeding gums, bad breath, loose teeth,
Laser.
you have gum disease.
You have gum disease.
Is that right?
Treat that problem with a laser and you're going to get better results, better post-operative results as well, and it's going to last longer.
Now, is this true that people that maybe were told we've got to pull out a couple of those teeth, you've actually, with the laser, saved the teeth?
Them. Oh, absolutely.
Is that right?
Yes.
That's common.
Yes. And we can show the evidence by looking at an x-ray of how much bone was lost. And
So the infection eats the bone.
the infection is an acid environment that's eating away at the bone.
Okay.
And that same acid environment can cause cavities in the tooth and in the root surface of the tooth. So it's controlling that acid production from the bacteria that cause the infection that's causing the breakdown.
So if you don't want to lose your teeth, get the laser done.
Get the laser done. Absolutely.